Apparently my Wheaton database email server does not talk to your DNR server. Now we're going to surmount those issues.
Yeah, we got it. All right.
Okay. So, thank you very much for inviting me to speak here today. My name is Mushir Assad. I'm an internal medicine doctor out in suburban Milwaukee at Brookfield, about 70 miles east of here. I have a 95% outpatient practice, but my girls need more shoes. I'll work at the hospital in the winter. That's to keep my people at internal inside the hospital. But I was asked to come talk about lifestyle modification in a primary care setting and how we're doing things out in Brookfield as a system in terms of helping our community be healthier as well. I'm about the last guy you think to be speaking at a cardiology conference. I'm an RVU robot, just out in the community working. But then we came up with some ideas as we're working about how we can better interact with our community. I think that's what got the conference staff here, so I'm excited about having you come out and talk. So we know that encouraging our patients to exercise is important. We know that those that are the least fit have the highest mortality. It's part of our job as primary care docs to make sure this is part of what we do at every visit. I know that we want to make sure that we've got our patients moving as much as they can. But do we have any evidence to suggest that what we're saying actually helps them? This is the first slide. So right here on the right, bar number 5 is those that are the most fit. They can do 13 minutes worth of exercise on a stress test. If you take that as your baseline, you can see that those that get less and less fit as you go to the left have higher and higher relative risk of death. This is what I like to bring up to patients to show them that even a little bit of transition in terms of what they're doing allows them to get closer towards what we want to be as most fit. This is from circulation. The references are all in your handout as well. The basic idea here, and what I can show on this graph, is that your risk goes up the less and less fit that you get, and then the better that you are able to get yourself moving, the better your risk goes down. If you compare exercise with other modalities of treatment that we have for heart disease, stroke, prediabetes, British Medical Journal tells us that exercise actually compares fairly well. And I like to show this to patients because most of my patients, they want to tell me, I don't want to fail. And so we have evidence that suggests that, hey, doing exercise can be somewhat similar to a pill. Yes, we do. And then here, if you look at 50-year-old men followed for 35 years, also from the British Medical Journal, those that have the highest physical activity in the green bars tend to do a lot better as they age in terms of mortality versus those that are least physically active. So the key thing here, this showed us that we want to make sure that we keep ourselves physically active and try and make sure we keep that as we get older. This slide here, I think it's important to share with people. Over here, you've got your most physically fit BMIs of 18 to 25, and it shows you that even for that group, you've got those that are least physically active versus most physically active, and you can see their mortality again goes up as they're less active. So you've got your 13.1 bagging on their car, shops at Whole Foods right here. Okay, and they're your pretty well candidates. These are the folks that are doing really well. But if you go over here to the right, this is my people. People that when it's wet, you get really excited, even if you're Muslim. Why? Because filet of fish is too fat off.
Yeah.
Now, if you think that's a good diet, you stick around for living like you're after. But here, you can even see that that group, this is me, being somewhat physically fit, really again brings your mortality down. So getting people to move is really important to help people live longer. So what do? We wanted to encourage our patients to be more active, we wanted to leverage exercise, and then in Milwaukee at least, we had a lot of employers pushing their employees to demonstrate physical activity to get their healthcare costs down. And so in that environment, we wanted to have a program that we could encourage people to keep themselves physically active. In Milwaukee, at least through Wheaton and a couple other employers, there's a program called Humana Vitality, which tracks your physical activity. and then you get points for that, and those points are added up, and that tends to get your healthcare premium costs down. Excuse me. So the idea for this whole Walking with the Wheaton Doc, that came from me reading the New York Times about 4 years ago. And there's a story back in February 2012 of a doctor in Denver that would get together with patients and gather them to meet and then be able to talk with the doc. I'm very fortunate in that with Wheaton, I've got a strong relationship with our communications and our public relations department. We do a lot of stuff in the community together. So I brought this idea forward to them. And I said, we should do something like this. You have a doctor getting together with patients in a public setting and taking them for a walk and just being able to at least have some social interaction with them. They thought it was a pretty good idea. They said, okay, let's try and push this forward. What this allowed us to do is encourage patients of all activity levels to come. I've got 25-year-olds that have their Lululemon outfits from Athleta and what have you coming. And I've got my 85-year-olds with their walkers. And we have different levels of activity that are present therein. We like to use the time to be able to allow patients to be able to walk together, have some fellowship, but then also, if you have a couple of different doctors from your system that are there, you get doctor speed dating. And so the people are able to ask questions, they're able to interact with the doctor to see what this person is like, so that those doctors can actually sometimes pick up your patients. So there's a business option to this as well. For us as a system, we're able to also showcase newer programs that are going on in our hospital. Obviously, again, if we have a new cath lab, we have a new 64-size CT scanner, we can kind of talk about these sort of new technologies that are out there. We can also talk about medical current events as we're going through. And for us as a system, it was really allowing us to fulfill our promise of making our community stronger, healthier, and better. Initially, when we started, we'd have about 20, 25 people coming. That started to go up in 2015. We do it once a month the entire year. We have to walk indoors when it's very cold, outdoors when it's warmer. We've been able to partner with the Brookfield Farmers Market, which is in the center of Brookfield. We'll meet just out the farmers market and walk a circuit around the middle of downtown, which is about 3 miles. That's during the warm weather months. In the cold weather months, we'll actually walk indoors either in the basement of the hospital or one of our outpatient centers will go in one of the outpatient floor settings to get the 2 to 3 mile walks in. As we're doing that, we'll stop about every 15 minutes or so to have me give a little medical blurb about a medical story of the week. Again, usually picked up from either Journal Watch or from the New York Times. Those blurbs are then posted online for patients to be able to see as well at the website you see, mywheaton.org/docwalk. I was actually quite impressed because for the entire Wheaton system, our DocWalk website was getting the most hits for all of 2014 and 2015. So I thought it was kind of a glamour star. So that was actually, you can see, they capped it out. People would spend a minute, 30 seconds going through on our website to get information, but then also to kind of search around. So bringing traffic to the website for healthcare information was important, and giving them stuff that they'd actually heard about through the walk was also important. That's how we do things to promote. You have ads like this in the paper, listing all our dates. The ad on the right here, that just kind of talks about the whole concept of walking with the Wheaton Doc. Initially, when the program first came out, that was actually a picture of me. I've been replaced by a pair of shoes. I think that's after I got my web presence and my ego got a little big, they decided to calm me down. Nonetheless, this promotion, I like to bring this up because it really shows us that when you have a good partnership with the PR department being able to push healthcare information out, it's important to be able to educate patients as well as bring patients to see you about more complicated issues. We've also been able to leverage digital media. Obviously, as we're preparing these walking tips, we're able to get that all online, and then we have it on the web. We've got it posted to our Facebook page, and then people are coming and trafficking to see and seeking out information. As I mentioned, where do I get my sources? I fully give credit to my inbox from Journal Watch, the guys out at New England Journal of Medicine. I check my inbox every day with the First Watch, and we use the New York Times Science section as well. But basically, patients are pushing us to be able to have a quick summary of what the medical news is for the month. They kind of get used to wanting to be able to hear what's been going on. This bottom picture is actually this last month. We were over at our TOSA facility in the upstairs. We would just stop and go in the auditorium every 15 minutes and talk about a different, and have a slide up just like this to talk about what was doing. Lots of questions about Zika virus this time. So we were able to kind of show them the Dr. Paul Sachs's blog post about the 12 different points to know about Zika virus. Just in case you wanted to know. And I think, why would we go to the effort of doing this? The reason from our standpoint is that we had done the dance with the evening doctor lecture with cookies and hearing about a procedure, if you need a new hip, you need a new shoulder. And our experience with that was getting pretty stale. Patients weren't really having too much interaction with it. They were listening for about 5 minutes just to see if they liked the doctor. Basically, they're using it as a doctor test out here. Well, this is a lot easier way to do that because you're able to walk with the doc, chat with them, kind of figure them out. We all obviously continue to do our in-office focused education, but a lot of the patients will tell us they really like the medical tidbits that they get during the course of the walk as part of their educational experiences with our Wheaton physicians. So for us, what this does is it allows us to have some degree of patients that are happy, our providers that come, and we have not just myself helping out with this. We've got podiatrists that come, we have physical therapists that come, we've got other specialists that come. They're able to talk with patients about their specialties, they're picking up new patients that way. It's a good way for us to really live out our promise of educating the community about their healthcare and using our tools to be able to educate patients about their health topics. Yeah, thank you.
I got involved in the Walk with the Doc program as part of an effort to continue my quest towards staying healthy.
I wasn't really walking and doing anything before. I was just basically sitting.
Well, I think we started because, first of all, it seemed like a fun activity to do, but the deeper reason is we were doctor shopping at the time.
I got involved with Walking with the Wheaton Doctor because I'm a single mom. I could save $50 a month in my healthcare benefits, and anything I could do to get expenses down, I did.
I was looking for a new doctor, and afterwards I asked him if he was accepting new patients, and I became a patient of Dr. Hassan.
One of the things that I think is very important is that there's a real social aspect to Walking with the Wheaton Doc.
And you catch up on each other's families already, and you don't see these people again until next month.
Another factor is it's a good time to have a conversation with your significant other. We kind of bring each other to the table, and then I actually have a relationship with the physicians in the same way. I can talk to them one-on-one, and we can have a conversation that I may not have had when in the office and time constraints are more difficult.
About every 15 minutes or so, Dr. Hassan or one of the other providers will give a little brief mini presentation or a little talk, very informal talk on a healthcare issue.
How many of you, by a show of hands, have heard of sleep hygiene? Okay, good. How many of you heard of personal hygiene? Oh, thank God.
It's materials that he gets from his journals, but yet he presents it in a way that it's understanding to everyone.
It's like I'm going through something, and then when he talked about it, I was like, oh, that's something that I, was going through, and it's really helpful. Or either it's something that I can go back and tell my mom, you need to do this or you need to do that.
Sometimes I go to the website to get more information, to get more in detail. Maybe I didn't understand it, what he was saying. And sometimes you don't want to stop, you just keep walking. So you wait until you get home and check this too.
When we're physically walking, we're encouraged to approach the physicians and other health providers that are in attendance with questions.
The next day at work, we went back and say, hey, I was walking with the podiatrist the other day, and here's the key learnings, and here's what I learned, and here's what you might consider. And a whole discussion ensued, and people actually changed the behavior that we're doing based on that.
It's nice to ask a simple question about blood pressure or glucose, and get that off your mind and not have to wait for your next physical.
We've talked about kids, we've talked about all sorts of things. And now when I see him professionally, he walks in, it's someone I know, it's someone I like, it's someone who I sense likes me.
I don't know that you ever really want to be that familiar with your doctor, but in this case, it's a good thing. You're getting information in a very relaxed setting, and it's information from medical professionals. You can't put a dollar figure on that.
Yeah, we're really sorry.
Okay, this actually gets exactly to your question, which is one of the considerations that we should have in terms of wanting to do this sort of thing. And so obviously for our system, we had someone like me that was kind of scouring the New York Times to be able to say, hey, this is an idea we should bring forward. But you really want to have one person that's pushing it as a physician champion. To say, look, we should do this, let's make sure we're there. That way you're reliable and you're sort of the person that's there. Patients have told us that they like the consistency as well. Is because what they like to see is they develop a certain trust with the lead physician. But they certainly like to have the other folks that come. Actually, surprisingly for us, after my popularity, the next most popular doctor is actually the diagnosis. Because everyone's got a foot problem. And so Robbie Amiat, one of our faculty, he's been wonderful about being able to be reliable and calm. And he gets all sorts of folks that are asking about this and that. They come to orthopedic doctors love this. Because everyone's got an ortho issue, they come, they have a chance to talk to patients, they've picked up countless super questions as a result. So I'm not the revenue stream of the ortho part. But I think that the key thing I would say is that you need to have someone that's there consistently, because that for patients it's important to have some contact person that's there they trust and is reliable. From a program logistics standpoint, you got to have one rabble rouser that's really kind of pushing. Otherwise, the thing will die. We've had in other markets and trying to do it by committee, it really doesn't work that way. Now, just the same, between being home with my kids, finishing up my Epic notes, and being able to do some other things I want to do, you're going to burn out. And so you want to try and get things moving, but you want to have sort of a cadre of 5 to 10 positions that you can rely on that people are kind of used to seeing. And so I think that's what we've been able. We're very happy to have. Again, I give Dr. Andy a lot of credit on this, of having folks that people are consistently seeing that they're comfortable coming to. One has to also be patient that things will grow slowly. We've gotten down to those 15 people in 2013. We had discussions whether we should continue with. As more and more employers added the financial incentives to their health insurance, people had to show physical activity, and we got the vitality points added in. That really added on for us the option that we could have to help employees generate some physical fitness points. I think that certainly as an employer, from a Wheaton standpoint, be able to tell our employees that you have to do a certain amount of physical activity, but then also giving them a very easy option within the system to be able to gain those points was a win-win. I think the other thing that we should not understate is the halo effect that you see listed. So I can tell one story. You guys, how many have been to Cops Custard? I walked. Yeah, so filet dish, Cops Custard, good night. It's great. So I was actually waiting in the left turn lane at Cops, and I bumped into the guy in front of me. And so I had to pull over to the side and kind of exchange names and numbers. So I was getting my name. I said, my name is Boucher Hassan, H.A. You're that doc that walks, aren't you? I said, yeah. He goes, I'll find him. That was great. All right, so that's halo effect. Okay, so I was able to get, and that's partly because, the hospital's got my name in the paper doing this sort of thing. You get this halo effect of, wow, look at this hospital system that's been encouraging physical activity in the community by doing that. It seems like a small thing, but it generates this downstream effect of, oh, look, they care about the community. And that really can't be understated. So we talked a little bit about this in terms of encouraging physical activity. When I see people for physicals, I like to encourage fitness goals as well as giving them modified weight goals for the year. Obviously Fitbits, having those because you want to track your activity so that Big Brother can track exactly how active you are. Pretty soon we had whenever you walk into a steakhouse, I'm sure as well. And you want to have employer incentives. Now, a lot of these things will tell you about, pushing people to 10,000 steps a day. And I think that, where is that coming from? This is kind of interesting study to find, which is if you look right in the middle, that's it. That's the 0 point. As you're going down, every 2,000 steps that you go up is listed here, and you can see that your risk for 5-year mortality goes down. So I like sharing this with patients to show, look, there's a science to this whole Fitbit 10,000 steps per day that's out there. And this is a study from the Cooper Clinic. This is actually probably one of my favorite studies to quote to patients. On the left is men, on the right is women. But what I always tell folks is how fast you can run a mile at age 50 is tied to your cardiovascular health. And I tell patients, cardiologists tell us this. They tell us, look, if you run a mile, 8-minute mile at age 50, that's obviously healthy. If you're at a 10-minute mile, that's not as healthy. But if you're above a 15-minute mile, you're on this latter part of the curve, which is not where you want to be. And so why do I do that with patients? I tell them, how fast is the treadmill when you're walking on it? Oh, 3.5. Yeah, that's not enough. You need to ramp it up. And you should be able to tell them, you might be breaking a sweat, but you're not really helping. And so I like to quote this study for them to show that, hey, you need to ramp it up a bit. And I like to quote patients, you should be in 5K shape all your life. You should be able to do that in about 30 minutes. And I think that the data for that comes from this study. We had some technical questions during our brief interlude. So we haven't taken any further questions that you might have. Yes, sir.
So how much marketing did your Wheaton Franciscan system do before it sort of really got rolling? I mean, you mentioned it's a slow process to get the buy-in from the patients.
Sure.
Because they've got to spend the time, they've got to take time out of their busy lives.
So the question was, how much marketing do we have to do before things really start out rolling? So this has been going on since about summer of 2012. And I would tell you that the numbers that we had 2012, 2013 were about 20 to 30 people coming. Those are mostly the diehard regulars that kind of had developed a relationship with me. Starting in 2014, we would have ads in the paper every month. And this is not the Journal Sentinel, it's just a local Brookfield paper. And then we'd have email blasts. We'd have people friend us on Facebook for our hospital page as well. And with all that, we've been able to develop a lot more traction with getting up to 50 to 60 people. Once we added the Humana Vitality points, where you can get Vitality points to show your employees you're active, then we hit 90 to 100. Last month we had 200.
Wow.
Okay, and the reason for that, I think, is I'd like to think it's me, but it's not. It's because of the fact that I think that this I think is important for us to understand. As more and more employers shift towards fitness-based incentives that they're going to push onto their employees, we as primary care physicians have to be able to encourage physical activity. We also have to give options for, do we as doctors know how the Fitbit works? So patients, if they're using it correctly, what are they doing to show track their activity? Hey, are you getting your points for that? Because I see a lot of employees of Wheaton that see me as patients. And so I'll make them get out their smartphones and I'll say, look, are you using your Fitbit correctly to get all your points? Because I don't want you to have healthcare costs that are up and getting a surcharge when you're in fact being critical. Because I see that at the doc. And so I think as that dynamic has changed in the market, that especially has been occurring since late 2014 in suburban Milwaukee. There's been much more push for employers to encourage physical activity, or you pay for it. And so as a result, I think that we've had more traction for something like this, and we've accommodated the program to be able to meet that need, which is being able to work with Humana Vitality to get them the points to show that they were there and to show that they were active. Yes, ma'am.
What age group shows up the most?
What age group shows the most? We have ages 5 up until 95. And all in between. If you're asking which age group shows up the most, I would probably say my guesstimation would be 40 to 65. But no, we have everyone. And what's been kind of nice, now we've developed enough traction where people are bringing their whole family. It's kind of they're starting their Saturday out this way. And I think having it at the farmers market makes it even easier because people come, they do the walk, they go shopping for fresh fruits and vegetables, maybe some cookies and popcorn too. And then they're on their way to do their errands for the day. But at least we're getting them started on the right foot. At the farmers market in the summers, we actually give them a coupon to get a free fruit or vegetable as well for the vendors. And so I think we spend maybe $300 for the whole summer getting those coupons. But everyone's walking around with their coupons throughout the farmers market because they want to go get. You're not going to just buy one tomato. So obviously, you're gonna have, people doing this to be able to at least go to a farmer's market and be able to buy fresh fruits and vegetables. In the back.
Do you walk a certain distance, or is it a certain time frame that you have, or?
Excellent question. So do we walk a certain distance, and is there a certain time frame? So we walk from about 9 till 10:30. Vitality will not give you points unless you walk at least 1.9 miles. For us, we tend to push it a goal of 2 to 3 miles. As I mentioned, I try to push the whole, everyone should be able to walk 5Ks, 3.1 miles. We try to at least make people able to do that. Some of our folks actually come, they run a 5K while they're doing it, to get the vitality points for doing that. Other questions?
That's it.
Thank you, Dr. Hassan. It was wonderful.